Good morning everyone. My name is Dr. Kala Vimal, a consultant dermatologist, Hairline Clinics, Bangalore. Today I am going to talk to you about chemical peels. What are chemical peels? What are the indications of chemical peels? Why one should do a chemical peel, etc. Now what are chemical peels? Chemical peels are nothing but they are the peels which are applied on the face. Okay. Now chemical peels, why they are done? They are done for resurfacing of the skin. What are the indications of chemical peels? Chemical peels are done for patients with different indications, like for acne or pimples, acne scars, pigmentation on the face, fine lines, wrinkles. So these are the various indications of chemical peels. It is also anti-aging. Chemical peels, it is a solution which is applied on the skin. Okay, so what happens when you apply a chemical on the skin? These are basically fruit acid peels. When you apply it on the skin, it goes into the deeper layer of the skin and it exfoliates from inside. So the fine lines, the wrinkles, the acne scars, the oiliness of the skin, everything decreases. So the skin becomes much better after using a chemical peel. Now there are various types of chemical peels. There are superficial chemical peels, there are medium depth chemical peels, there are deep chemical peels. Superficial chemical peels is when the chemical penetrates in the superficial layer of the skin or the epidermis. It doesn't go into the deeper layers. That is done for superficial wrinkles, superficial fine lines. We do a superficial chemical peel. Now medium depth chemical peel, when it goes into the epidermis, that is the superficial layer of the skin, it goes into the upper dermis, that is the middle layer of the skin. So that is done for deeper lines, deeper wrinkles. Okay, that is medium depth chemical peel. Then the last one is the deep chemical peels. That is a deep chemical peel. What is deep? It goes into the, it not only involves the upper layer of the skin, epidermis, it goes into the deeper dermis. So when there is deep wrinkles, that is the time when we do and there is a lot of damage to the skin. That is the time when we do a deep chemical peel. And when we do this chemical peels, what is the interval between the chemical peels? Chemical peels, the interval between the chemical peels is once in 2 to 3 weeks, depending on the indication, whether it is acne, whether it is seborrhea, whether it is wrinkles. So different indications we do depending on the depth of the peel. So it can be 2 weeks, can be 3 weeks. So we do it once in 2 to 3 weeks. And the results are phenomenal. So once after the chemical peel, the superficial layer of the skin is peeled off. So you get a skin after the chemical. What is the end result? You find you see a skin which is much better, less of wrinkles. The acne has decreased. The oiliness, seborrhea has come down. So the skin becomes much better. The skin starts glowing. The oiliness decreases. The acne improves dramatically, and overall the skin becomes much brighter and better, and it gets resurfaced and rejuvenated. So patients who have all these conditions can, even those who don't have acne, who have fine lines, wrinkles, they can go for chemical peels. Okay, so and you can maintain also once in a month after you finish 6-7 sessions, once in 2 to 3 weeks. You can maintain it like once in a month, once in 2 months. You can go for a chemical peel. So it's a very good procedure which is recommended done by the dermatologist, and the results are also phenomenal.